Hello everyone, this is Dr. Vijay Raghavan. Welcome back to Vijay's Wisdom. What are we going to see today? Today's topic is fits, which causes panic in everyone, especially people around. Somebody starts developing fits in a public place, everybody around gets worked up, not knowing what exactly to do. So let's talk about this fits. What is a seizure or a fit? Convulsion or fit or seizures, whatever you want to call it, is a commonly rapid involuntary muscle contraction that causes uncontrollable shaking and limb movement. Suddenly somebody starts throwing a fit. He starts moving his muscles involuntarily, causing uncontrollable shaking and limb movements. Fits cause a person's muscles to contract uncontrollably, lasting for few seconds to few minutes. When the seizure occurs with a muscular movement, it is called convulsion. So there are seizures where there is no muscular movement. What you see as a muscular movement, which is commonly called as fits, is only a part of group of diseases called seizures. There are other types of seizures which do not show muscular or limb movement. The classical of this is an absence attack. We'll look into it as we go down. Epilepsy. This is the commonest cause for fits or convulsion, though there are many other conditions which can cause fits. The commonest cause for fits is epilepsy. Epilepsy is a long duration or a chronic brain disorder in which a group of nerve cells in the brain sends wrong signals which cause a seizure. Suddenly, all of a sudden, without any provocation, they send nerve impulses across the different parts of the brain, and if it reaches that part of the brain which is responsible for muscle movement, they start throwing convulsions. Normally, brain cells generate electrical and chemical signals that act on other brain cells, other organs and muscles. If it acts on other brain cells, it produces thoughts or feelings, or if it affects the muscle, then it produces actions. During the seizure, many brain cells send signals at the same time, much faster than usual. This leads to involuntary movement or sensation or emotions or even behaviors. Epilepsy causes temporary abnormality in muscle tone or movement, like stiffness, twitching, or limpness. It can cause abnormalities in behavior. It can cause abnormalities in sensation or state of awareness. As we said, depending on which part of the brain most of the electrical impulses get into. There may be loss of awareness. Some may take minutes or hours to recover after a fit. During that time, they may feel tired, sleepy, weak, or even confused. When a fit occurs in two or more unprovoked episodes, it is considered to be epilepsy. This is an important one. Epilepsy is a diagnosis which is very common, but is often an exclusive diagnosis. We'll come into that. If you do not have any reason for the fit, then it is considered epilepsy. So a person who suffers from a single fit which does not repeat is not an epilepsy. So a person known to have epilepsy, known to have fits recurrently, then in all probabilities it is an epilepsy. Single fit, it is important to make sure that he does not have a correctable cause for the convulsions. We'll look into it as we go down. What are the risk factors or triggers for epileptic fit? Okay, I am known to have an epilepsy. What causes the fit? Why do I develop? Who are the people who are risk for developing epilepsy? The cause for epilepsy is unknown. Only known risk factor is a family members with epilepsy. A person who has got an epilepsy is likely to have a family member who was also suffering from an epilepsy. So if there is a family history of a fit, then in all probabilities the diagnosis is going to be an epilepsy. But a person known to have epilepsy may throw a fit by following a triggering situation. What are the triggering situations? Number one, stress, drinking alcohol, or alcohol withdrawal. Alcohol withdrawal is a very common cause for fit. Dehydration or low sugars. Hormonal changes during menstrual cycle can precipitate a fit in a person who is known to have epilepsy. Sleep deprivation can cause a fit, or visual stimulation like flashing of light or moving patterns can precipitate a fit in a person known to have epilepsy. There are two types of fits or two types of seizures. Focal, where only one limb or part of the body is affected, or generalized, where the whole body is affected. The person is shaking the whole body, whereas in focal fit, one arm, maybe the right upper limb or left lower limb alone can produce shaking. Focal fits affects one area of the body. It may affect only the eye muscles, producing repeated blinking or twitching, mouth movements, walking in circles. Or a person may perform complicated actions like washing dishes in a repetitive, unproductive fashion. These are all focal fits. You think he is washing the cloth, but actually he is throwing a fit on that hand alone. But the person remains conscious. He may experience motor, sensory, or psychic feeling or sensation. He may experience sudden unexplainable feeling of joy, anger, sadness, or nausea. The person may notice minor symptoms referred to as aura. Aura may be altered feeling or sensation that something is going to happen, like premonition. So, focal fit person can have an aura. Coming to the other group is called a generalized fits, generalized seizures. This is due to abnormal neuronal activity that repeatedly emerges on both sides of the brain. So it can cause loss of consciousness, it can cause falls, or it can produce massive muscle contractions. In generalized fits, the person may feel confused or dazed, experience minor shaking, muscle stiffening, fumbling, or even chewing motions. There are different types of generalized seizures. Number one is absence seizures, or medically called petit mal epilepsy. Here there is a brief staring episodes. There is no jerky movement of any part of the body. Suddenly he goes blank, is looking at something as if nothing is happening. This is called absent attacks, and this is called petit mal epilepsy. If this is seen in children, it tends to disappear in adulthood. Second type of seizure is tonic seizures. There is stiffening of the muscles of the body, normally in the back, leg, or arms. In clonic seizures, which is the third type, there is a jerky movements of both sides of the body. This is a common thing what we see. There is a fourth type called myoclonic seizures. This is a fit consisting of sudden body and limb jerks that can involve the arms, head, and neck. The spasm occur on both sides of the body in clusters, in groups, especially in the morning. This is a classical fit which attracts lot of public attention during episode. The fifth type is atonic seizures. Here there is a loss of normal muscle tone and the person suddenly falls or drops the head involuntarily because his muscle tone is lost. For a few seconds he doesn't know what is it and suddenly he falls on the ground. He may have loss of tone of the neck muscle, so the head may drop. This is called atonic seizures. And there is a tonic-clonic seizures. Here is a combination of stiffening of the body and repeated jerks of the arms or legs with loss of consciousness. And the seventh type is secondary generalized seizure. When it begins in one part of the body and then spreads to other parts of the body. Focal fits followed by a generalized fit. Normally, a generalized fit occurs throughout the body from the beginning. Whereas if it goes from a focal fit into generalized fit, it is called secondary generalized seizures. One important component we have to know is fits due to fever. Fits can occur in any child due to high temperature. Fever-associated fits resolve by the age of 5 to 6 years. Essential issue is to bring the temperature down under control to avoid fits. This is not a symptom of adulthood epilepsy. Just because a child used to get fits in high temperature does not mean the child is going to be an epileptic when it grows up. It is not a danger sign. But if it occurs without fever, then epilepsy should be considered. What are the essential points in epilepsy? Fits are result of abnormal electrical activity in brain with no other known cause is classically called epilepsy. The important point here is no known cause for fits. If it happens, then it's called epilepsy. Specific cause for epilepsy is not known. So it is mandatory that every known cause for fit should be ruled out before naming it as epilepsy. Because once a person is called an epileptic, he has to be on medication lifelong because he does not have a correctable cause for his epilepsy. Since epilepsy-induced fits need medication to control, but other causes for fits, which are so many, need specific treatment like treatment of the infection if there is brain infection or surgery for brain tumor which can be the cause for fits. So what are the other causes for fits? Head injury is the commonest cause. When we say head injury, it means brain injury in medical parlor. Injury to the skin of the head is not considered head injury. Stroke is another cause for fits, which is caused by the reduction of blood flow either due to blood vessel block or bleeding into the brain. Reduced blood circulation to the brain due to any cause can produce fit. If the BP is low and the brain is not getting enough perfusion, it can throw a fit. Brain tumors can cause fits. This is the most important disease to be ruled out if there is a fit occurring in an adult for the first time. Low blood sugar is another very important cause for fits. This is the most easily correctable cause for fits. Once you raise up the blood sugar level, his fits will disappear. Pregnancy complicated by eclampsia. This is a condition where a pregnant woman has a high blood pressure, she's got a protein in the urine and severe headache. This person, blood pressure can go out of control and she can throw a fit in her pregnancy. Other causes for fits is abnormal electrolytes, so sodium, magnesium and calcium, vitamin B6 deficiency. Malaria can affect the brain where the malaria is very rampant, very classically in African countries. Some specific chemicals like cocaine or abrupt withdrawal from substances like alcohol and other drugs. This is a very common issue. An alcoholic is prevented from taking alcohol, he may throw a fit. One of the common symptoms of withdrawal of alcohol as well as drugs. Some infections like meningitis, which is an infection of the membranes covering the brain, or encephalitis, which is an infection of the brain itself, they can produce fit. Alright, so what do we do when we see a person convulsing or throwing a fit? First, place them on the floor to avoid fall and injuries. Place them on the side to enable easy breathing. Remove hard or sharp objects which can injure them. Place something soft or flat under their head to avoid banging of the head leading to head injury. His head is moving involuntarily and it can forcibly hit the floor and produce head injuries. Remove their glasses as its breakage can cause injury. Loosen up or remove anything around the neck, very commonly a tie or a necklace. Call the ambulance if the seizure lasts more than 5 minutes or there is multiple fits in quick successions. Repeatedly, if he is throwing fit, he needs medical attention. What are the special risks in epileptics? This is called status epilepticus. It's a state of continuous fit over a prolonged time. It's a life-threatening condition. The person does not gain consciousness between the attacks. This gentleman needs immediate medical attention. There's another entity called sudden unexplained death in epilepsy. This is a death which occurs without injury, drowning, or other known causes of death. And death happens during or right after a seizure. Suddenly he throws a fit and he dies. This is called sudden unexplained death. Now, what are the issues with epilepsy? Depression is common in epileptics. Driving issues. How safe is it for a person with epilepsy to drive? This is a legal issue and there are a lot of controversies for each government has a different take on this. So it is still undecided. Definitely epilepsy will limit the ability to participate in sports, exercises or other recreations. Climbing, sailing, swimming or working on ladder may be limited. Regular exercise may reduce epileptic attack, but it has to be done under supervision. Barriers in education and employment. Just because in epileptic, a person's education or employment may be in jeopardy. Regarding pregnancy and parenthood, can an epileptic beget a child? There is no issue in pregnancy as long as they are on anti-seizure medications. Thank you very much for your kind attention. We'll meet again in another episode with another topic of interest. This is Dr. Vijay Raghavan signing off. Thank you.